Good afternoon and welcome to our Town Hall discussion on the impact of COVID-19 on Delaware women. My name is Melanie Ross-Levin and I am the Director of the Office of Women's Advancement and Advocacy, and I will be moderating today's discussion. We have with us today Congresswoman Lisa Blunt Rochester, Lieutenant Governor Bethany Hall Long, as well as Saron Cade, who is the Secretary of the Delaware Department of Labor. Thank you all so much for taking the time to be with us today. Before we jump in, I wanted to take a moment to thank all of the Delaware women's organizations that are co-sponsoring today's event. Thank you for all that you do. And a special thanks to DETV, who is broadcasting us live on Comcast Channel 28 and all of their social media channels. We appreciate your support. I also wanted to let all of the viewers know that we are starting with pre-submitted questions from the co-sponsoring organizations, but we will also be taking some live questions. So please feel free to either email us the questions at delawarewomen@delaware.gov or comment below the Facebook Live feed. Now that the logistics are out of the way, I wanted to briefly put today's conversation in context. We are here today because we thought it was important to shine a light on the impact of COVID-19 on Delaware women. This is especially important as we continue to transition into recovery. It is clear from our report on Delaware women and the impact of COVID-19, which we will link in the thread, that Delaware women, especially Black and Hispanic women, have been disproportionately impacted. Not only are Delaware women the majority of cases of COVID-19, but also the majority of deaths. Delaware women are much more likely to serve in frontline jobs, such as in hospitals, home health care, and childcare, but have also been seen to have higher temporary job loss due to the impacts on retail, restaurant industries. And on top of all that, which is already a lot, we can't forget caregiving and poverty, which disproportionately impacts women. So to speak to this, let's start with our first question. Congresswoman, this pandemic has exposed several gaping holes in our safety net. I'm particularly worried about how many Delawareans lack paid leave, affordable childcare, and paid sick time. What shifts are you seeing in these areas, and is there hope for a real change?
Well, first of all, thank you, Melanie, for having me, and thank you so much to the Office for Women's Advancement and Advocacy, and to my fellow panelists, Lieutenant Governor and Mr. Secretary. It is good to be with you this afternoon, but we all know that these are trying times. And as I think about your question, the bottom line is what you said was, what can give us hope? Let's start out with the fact that you've already laid a pretty strong foundation of what we're facing, and also kind of the impact of women in our society, as well as it pertains to the state of Delaware, and then the disproportionate impact that COVID-19 is having on us. I think about the various roles that we have, and I think about the fact that it is touching us both in our professions, as you mentioned, whether we're a frontline worker or an essential worker, and it's also touching us in our personal lives and in our homes, whether we are caregivers for parents or for our children, wondering about whether they'll be able to go to school, or even being that caregiver who has the job as a childcare provider. There's a lot of uncertainty and a lot of concern and fear and worry, and rightly so. As I think about what is happening in Congress, many of you may have been following some of the bills that we've passed, like the CARES Act or the Families First Coronavirus Act. That gave me hope, because in the very beginning, we as a country, Democrats and Republicans, realized that this pandemic is so epic that the response has to be equally comprehensive and epic. And so you saw Democrats and Republicans, folks that would never even vote on the same thing sometimes, step up and support things such as paid leave, expanding FMLA, expanding unemployment insurance benefits, the PPP program, recognizing that many of the businesses that are going to be hardest hit are those small businesses and those women-owned businesses. And so from the life and livelihood perspective, we came together to be able to put some real meat on the bones of a situation that is really has been a challenge for us. Right now, where we stand is that many of you are probably watching, we in the House passed the HEROES Act. And part of that was to make sure that state and local governments like us here in Delaware have the funds that they need. I mean, our Secretary of Labor, Saran Cade, will talk about the Department of Labor and some of the challenges that they have. And Bethany, our Lieutenant Governor, will talk about some of the health challenges that we have. The bottom line is we need to make sure that state and local governments have the money that they need so that they can respond appropriately to this situation. And that affects women. We also had a bill and expanded legislation for childcare. One of the great things is that it's not just a women's issue. I was on a call with business leaders, and they wanted to know, what are we doing in terms of investments for childcare? The House has put forward legislation that I'm a co-sponsor of and that we have passed, but we're still waiting on the Senate. And we have some real issues in terms of philosophy and priorities there. I still have hope. I continue to have hope. That's who I am. I am a pragmatic optimist. And I think because of the situation that we're in, people realize that we're all connected. And in order for the economy to open strongly and our schools to open strongly, everybody needs to have confidence, whether it's the testing, contact tracing, or the treatment that needs to go along with it, which we've also introduced legislation for. And it's going to require all of us to do it together. The last thing I'll do before I turn it over back to you is to just say that I want to make sure up front you did logistics. I want to make sure people know that if they have questions about any of these things, they can contact my office at 302-830-2330. And that's again, 830-2330. And also go on the web at bluntrochester.house.gov if they have questions. We try to keep updated on COVID-19 things. But I wanted to just be on this call with these incredible people because I want people to also have hope that we are all working together as a team here in Delaware to make sure that people's life and their livelihoods are taken care of. And so thank you for having me.
Thank you, Congresswoman. Really appreciate that you're here today. So this next question is for our Lieutenant Governor. Disruption caused by COVID-19 related shutdowns have highlighted how women's careers often take a back seat when duty calls at home. As the new school year approaches, how do we help parents, primarily mothers, who continue to juggle work and caregiving responsibilities?
Great question. And as indicated through our Congresswoman, and we'll hear from our Secretary in a moment, Melanie, the Women's Advocacy Office for Advancement and Advocacy is there for women. I can tell you, and I know our Congresswoman knows, and I know Saran is a parent himself with 2 young girls in school. The school year is coming and there are stressors, whether it's online school that we're doing at home, trying to take care of groceries. Maybe we have an elderly parent and we have resources available. I could spend the entire program talking about both the federal and state programs that we have put in place for women and men, but mostly women who are in the front line. Your report, and to the listeners out there, I encourage them to look at your report. It's simple, it's easy to read. You highlight, thank you for the show and tell there, you highlight in your report how that, women are at the front line, particularly during this COVID impact. If you think about it, 77% of the women who are in frontline positions, 93%, I'm a nurse, of us in the health field are in the front line. And I know that's why our Congresswoman worked hard with the CARES Act and why our Secretary of Labor is working to make sure on the other side, those who aren't employed, which are mostly, as you indicated early on, women, over 54% of those in the unemployed side are women. And in particular, women who may be from the food service, but also to barbershops and hair salons, right, are in that front line. So you take that unemployment stress or the overemployment working with PPE in the front line with childcare. What does that do? That adds to the balloon of stress, right? We say picture a balloon. The more air we blow in, the more bigger the stress. That's like a person. We want to help people deflate their stress. And so we're hoping that as the school year starts, they turn to people for resources and recognize it's okay not to be able to do it all. I think most women have a cape called Wonder Woman or Superwoman around them. And sometimes we have to say, time out. I need to call 211. I need to call the Hope line. Our Congresswoman always talks about hope. So isn't it appropriate that our Department of Substance Abuse and Mental Health has created a Hope line? And that Hope line is easy to remember. We're going to make sure you have the link. It's 1-833-946-7333. You can call anytime during the day, the evening, when you're stressed. And also by calling 211 can link persons to support groups. I encourage you to pick up the phone and talk to others, help your neighbor if you know someone needs support. And that's what the women advocacy is about. And that is a strength. It is not a weakness to say, I need help when you need help. We recognize, we see it in the headlines every day about persons thinking about hurting themselves or families arguing more. More arguments are happening at home with domestic violence. So we want folks to know they can call 211, they can call the Hope line, and we'll get you the other phone numbers for Help Is Here. Delaware, we know that sometimes we turn to more substances, more alcohol. We want you to know we have the help. So later on, we'll make sure you have those links online so that you can link directly into support services. And so thank you for that question. I think all of us know that during these challenging times that it's difficult. And I know for many of us, people have had to relearn algebra and relearn programs helping their kids at school. Turn to your PTAs. Make sure if you don't have the services, your Department of Education, your local education association has devices. They will get your children those support services. Last thing I'll say, I visit a lot of women who work front lines, who have to have housing insecurity, and they're staying at grandmom's or they're staying at a neighbor's or at a local hotel. Please call us. We will get your children those support services and devices that they need. So back to you, Melanie.
Thank you very much. And we'll be sure to put those links and resources in the thread, in the Facebook thread, so that we can all take a look. Now we're going to jump into jobs. That means you, Secretary Cade. Traditionally, Delaware women have made up a small percentage of jobs in STEM-related trades, including apprenticeship programs. What can we do to help open up more of these opportunities for women looking to transition into these types of jobs?
Well, first, thank you, Melanie, for inviting me to speak. It is definitely an honor to be the only guy up here, but I truly appreciate it. And thank you to the leaders that we have here, Congresswoman and Lieutenant Governor, for the work that they've been doing. Also recognize a former Labor Secretary and Congresswoman Blunt Rochester and the work that she did in this role. And so I'm definitely happy. Some big hills to fill, but even though I'm much bigger than she is, but those hills are pretty big to try to fill myself. I would. That's a great question. One of the things that, as Lieutenant Governor mentioned, it's really hard to look at COVID and the impact on that it's had on women in the economy without really looking at where we were previously. Before COVID occurred, 55% of people who were collecting unemployment benefits were men. What we saw after COVID immediately, once the shutdowns began, is that number flipped and women became 55% of the individuals who are collecting unemployment. And that's specifically because of the industries that women are highly represented in. Not only that, but when that occurred, the unique thing that we also saw, which is a telltale sign, is that the hourly rates of individuals, even though the economy was tanking and people were out of work, the hourly rates and hourly wages of workers actually went up. And people said, well, how does that make any sense? And the reason was because a huge chunk of women and women who were serving in jobs and food services and other lower wage industries were removed from the economy. So we saw firsthand with the data the discrepancy that women face in the workplace every day. And part of that is related to discrimination. Another part of that is related to the industries that we look at. It's unique to see that women are not as highly represented in science and math fields. What our data has also shown us is that in every age from third grade to SATs, women do significantly better in math testing than men do. So this is not a question of competency. This is a complete question of access, and a question of making sure that our actions are deliberate when it comes to connecting women with to industries like science and math. Apprenticeship is another one. There are about 1,500 registered apprentices who are actively were recruited this year. And just this year's recruitment class of about 1,500 apprentices just this year, only 38 of those are women. 38. And a large percentage of that, almost a third of that, are representative of one of the apprenticeship programs that we created about a year or two ago for child services and child care. We created an apprenticeship program for child care. So not only do we have to do a lot of work to encourage and market apprenticeship opportunities to women and minorities, but we also have to look to create apprenticeship programs in industries that traditionally have not had them, where women are highly representative. So childcare, we've also established one in food services to help people go from being servers to line cooks to managers. And so, it's got to be a multi-pronged process in the way that we attack it, but it has to be deliberate in everything that we do. So whether you're talking about encouraging and moving women into and marketing new careers and industries to women, or you're talking about improving the industries that they are currently highly represented in, we cannot attack this just by saying, okay, we want you to go from working in the food services industry to working in a math or science and technology industry. That's going to be important, but it's also important to focus on things like tip wages, making sure that people who are working in hourly fields, which large population end up being women, making sure that they have access to benefits and other resources so that they can take care of their families and put food on the table, send their kids to school, and all the other things that come with having a steady income.
Thank you, Secretary Cade. From jobs to stimulus, Congresswoman, what progress is being made to ensure that the needs of populations that are disproportionately impacted by this pandemic, including Delaware women, are considered in stimulus and other recovery efforts?
Well, thanks for the question. And I guess I want to sort of go back and sort of put all of this into context in terms of what I've heard from both of the other panelists, as well as what you've shared and what's in your report. And I think the bottom line is what COVID-19 has done is basically shined a light on things we already knew existed, and that these issues are not relative to a program here or this there. It is really structural and institutional racism and sexism that we are now seeing the fruits of. Everything from how people of color are being disproportionately contracting and dying from COVID, to how women are being exposed to unsafe work, places if they don't have the PPE they need, or the challenges of being able to get a loan or a grant like PPP or an EIDL loan. These are challenges, and even knowing, do I already have connection to a bank or a lending organization that could help me? Many of these things are not new. And many people know I've been really focused on the future of work, because I thought that artificial intelligence, machine learning, automation, I thought those were the things that were going to hold people behind, and that we needed to be really fearful of. Secretary Cade has even been on panels with me to talk about the future of work, and how out of the top 10 jobs that African Americans hold, 6 were at risk from automation. But what COVID-19 has done is shown us the inequities that exist. It has shined a light, and it has made us say, this is deeper than this moment. And so even as we look at what we're doing in Congress in terms of bills and appropriating money, one of the major things were those stimulus checks, because if people fall off a cliff, it's not just their individual family, it's the restaurant that they would go to. It's the store that they would get some sneakers from. We're connected. And so it is vitally important that people have the stimulus payments that they need to be able to survive, to pay that landlord. Then if you can't pay your landlord, then the landlord is in trouble. And so it's all connected. And that's why it's really important that we have these comprehensive attacks on it. But we also have to be very specific, diligent, and intentional about where we put the money. We can't give PPP loans to, you know, a big chain organization that doesn't need the money when that woman who is trying to run her child care center doesn't have the access that she needs. So even in this next package, what we basically said is that we have to focus those resources on the places that need them most. Small businesses, women-owned businesses, minority businesses. The same is true with healthcare. We need to make sure that if we're going to test people and have treatment and contact tracing, it needs to be targeted. And that's what the lieutenant governor is working on, is making sure that we're not just doing a scattershot thing. We're taking the money and we're putting our resources where they're most needed. And I think that, to me, you know, back to your question, you know, in terms of stimulus, and that's why we passed the HEROES Act 2 months ago. And that's why we continue to push, because it's not enough to just give people a little bit of money. Somebody said to me, you know, that's too much that we gave folks for unemployment insurance. Well, the reality is during COVID-19, you know, our poverty rate went down. What does that say? What does that say about what things were pre-COVID? So this is an inflection point for us as a country. And so that's in Congress what we're pushing for, and that's what folks on this phone are pushing for, is to make sure that we're not just using this as a moment, but really looking at it from a structural and institutional perspective to make real change so that we can see real outcomes, not just for COVID, but moving forward.
Thank you, Congresswoman. Now on to housing. Lieutenant Governor, the wages Delaware women make are key to sustaining families, and that means paying the rent and mortgage.
Mhm.
What assistance is available for Delaware families when it comes to housing?
Wow. I think, you know, as our Congresswoman said, you know, the stimulus and the programs that we need have to touch the people, right? We need them to have the housing, the security. And thank you to the Congresswoman and our senators who fought hard for the programs and the HEROES Act and the more funds. And I know you're going to get compromised. Something's going to happen for those who are sitting on pins and needles, you know, who are waiting. Governor Carney this week, some of you were there. I know Secretary of Labor has been present with our housing authority, you know, Naspanati, and our programs, both from the county to the state to the federal government. We all come together. You have to have a roof over your head. There is nothing more important. And as our Congresswoman knows, and as Secretary of Labor and women's advocates who've been on the streets with me, when I find a disproportionate number of women living in housing unsecure situations, who are homeless, we've got to prevent that. And so our governor, in combination with our partners across intergovernmental, announced this week the up to $5,000. There's an application process, both for those who have home mortgage challenges or rent assistance, and then even for the landlord. So thank you to the intergovernmental processes. And again, we'll make sure that those phone numbers are available to you and for you, because people need that. They need the shelter. And women, again, disproportionately end up often in the car living or having those challenges. And so combining all that, and that's why we go back to the stress management and the programs that we've put in place during COVID, but have been present all along. And I think our Congresswoman addressed it. I know your report shines a real light on it, that these inequities just have become more visible, as our Congresswoman stated, during these times and challenges. So apply, get to know the programs, contact, as our Congresswoman said, her office, contact my office. We are there to provide those supports to you. And so give us a ring and we'll try to get you connected to the housing.
Thank you so much. Thank you, Lieutenant Governor. Now to unemployment insurance. Secretary Cade, what is the first step in applying for unemployment? And what can Delawareans do to avoid missteps in the process?
So the first step to applying for unemployment benefits would be to visit our website at UIWorks. I'm sorry, ui.delawareworks.com, ui.delawareworks.com. That site, you'll be able to get either a phone number so you can apply for benefits through our telebenefits hotline over the phone, or you can apply online. First, in order to apply, you have to go through a LexisNexis security assessment to determine that you are who you say you are. States around the country, we have been combating fraud while at the same time trying to balance getting benefits to people who need them the most. And so the first hurdle that people typically get clipped up on is answering security questions that, someone with your social security number would know. The name of your mortgage lender, the name of the lender who's, has your car note, things like that. Once you get through that process, it is important that you provide all of the accurate and factual information. Everything we've seen mistakes from everything from misspelled names and addresses to, banking account information inaccurate that would delay a direct deposit. And so making sure that all the information that you're providing is accurate and factual. But at the same time, each person who applies for unemployment, they still have to qualify for benefits. And the first stage of qualifying is ensuring that there are wages in the system that have been reported for you. So if you work at a traditional job and we have wages in the system for you, that crosses the first hurdle. The second is making sure that your separation from employment actually qualifies you for unemployment benefits. This is an area that has clipped up some people. There's some specific information as to what qualifies you on our website, but traditionally, quitting your job for a non-COVID related reason. What I mean by non-COVID related are the reasons that are specifically outlined in the governor's executive order, like contracting COVID or needing to be quarantined and things like that. Being afraid of contracting COVID is not listed in one of those exemptions. And so when individuals quit their jobs or their employer has provided them with some suitable alternatives like working from home or taking leave and things like that, and these individuals may quit because they may see unemployment as being a little bit more than what they were making at that job. And even if it's not, they weigh the risk of going in and they make a reflective decision to quit, which I think a lot of us would understand. However, that would not qualify you for unemployment benefits. And so once you go through that process, in the best possible outcomes, individuals receive their benefits within a week. When we have problems that need to be troubleshot, that's when we get to the long delays because it's just a huge line trying to get access to staff for unemployment. And this is something that we see around the country. I talk pretty regularly with our secretaries of labor in surrounding states, and we're all dealing with the same issues. Obviously, they're dealing with them with much larger numbers, and we're dealing with them with smaller numbers of claims, but also a smaller number of employees. So prior to COVID, we received about 500 unemployment claims a week. And to this point, at our high, we received 20,000 claims in a week. And that unit who's responsible for processing those claims had about 15 people in it when we first started this. So in the midst of all of this, we've had to restaff or retool, add more people to the agency, and as well as combating COVID internally, making sure that our call centers don't have outbreaks themselves. So it's been a heck of a process, but our goal is to try to get benefits to as many people as possible. Our pandemic unemployment assistance program, we also had to stand that up in the midst of all of this and create a new program for people who don't qualify for traditional unemployment for reasons such as they're independent contractors or self-employed workers. And that program is off and running, and we've probably paid about $70+ million out of that program alone. And in total, the state has paid about $750 million in unemployment benefits over the last 3 months, which I really can't even quantify what that means to the workers of the state and the volume that is for this small agency.
Thank you, Secretary. So now we're going to take some questions from our comments section and from email. Our first question is for the Congresswoman and is related to how COVID-19 is impacting women and girls leadership and developing leadership in the future. Is there anything you can share about the Girls Lead Act, HR 6626, that was introduced in the House?
So, well, first of all, I think it is important that we continue to stand up and step up and continue training and mentoring and educating each other. I know Bethany and I are both involved in work on STEM and STEAM to make sure that is highlighted in our state. I've been involved even in making sure that our teenagers and others have access to our office to continue with internships. I mean, not the teenagers for the internships, but we have college students that are working with us on internships. But on the bill in particular, I think part of the challenge right now is that our focus has to be on the life and livelihoods of everyone in this moment. That doesn't mean that the work stops and that we are not continuing to introduce bills and to vote on bills, which we are. And I personally am committed to the pipeline of young women and girls. And I know Secretary Cade is as well, as he has 2 young daughters himself and knows that this is a priority. But yes, we continue to do that and look forward to working with anybody else out there that is interested. Again, reach out to our office, not just for that, but also with issues like IRS, immigration, Social Security. We're doing an incredible number of calls for those kind of issues as well. But on your particular bill, if you reach out to us, we'll give you a little bit of insight specifically on the details.
Okay, our next question asks that the panelists speak to the action plans, if any, that are in motion to address the disparities and discriminatory practices in Delaware related to health, employment, and education for Black women. And they're asking for things other than task force creations and commissions. So that really could be if any of you want to jump in.
So I'll jump in on that. It's a really good question. Prior to COVID happening, we had drafted some legislation that we had introduced to a few legislators that would start providing benefits and other assistance to people, specifically restaurant workers who are hourly employees. Right now, our tip wages for hourly workers is capped at about $2 and some change an hour. And what we wanted to do was reconnect that to the traditional unemployment rate, where it used to be in the early 90s, so that could grow with unemployment, with not unemployment, but with the minimum wage. So connect the tip wage with the minimum wage so that as the minimum wage increases, the tip wage increases as well. Also mandating that individuals who show up to work and their employer may not have work for them that day, that employers would have to provide them with wages for up to 2 hours, even if they weren't able to work or they didn't have hours that day. What we see a lot of people, specifically women, who are working hourly. You show up to work after you got the Uber or you got the taxi and sent the kid to the babysitter, and you get to the job and they say, "Oh, sorry, nothing today." A lot of these workers, specifically women, not only do they have to eat the cost of gas to get to work, but they still have to eat the cost of childcare and other things that they had to set up in order to get to the job, and that's just not right. And so there's not going to be one specific thing. It's going to be death by 1,000 cuts when it comes to discrimination. We didn't get here overnight, and we're not going to get to where we need to be overnight. But identifying these systemic and structural barriers to individuals being able to collect a good, fair wage for fair work, that's going to be part of our strategy in addressing it. There's a few other things that we have and have had in the pipeline, but specifically focusing on tip workers, tip wages is one. Also, we were expecting this year the Crown Act to come into play in Delaware prior to COVID hitting, and the Crown Act would basically eliminate discrimination for based on hair in the workplace and in other public locations, but specifically on the work site and in workplaces. So we were very proud to work with Representative Mimi Brown and Senator Darius Brown, no relation, on that piece of legislation.
Great. I would love to just jump into on this question. First of all, I appreciate the question because basically inherent in the question is that historically we do know that there are commissions and task forces and things like that that are established for a whole number of issues. And right now we face a sense of urgency. And so it's everything from kind of going down dual tracks, you know, as Saran said, there are some things that are going to take, that have built up and require like the due diligence of understanding what the issues are and trying to figure out a path there. But there are some things that we already know and that we already need to just put the resources towards and pass the legislation and implement. One of the areas that I've been fortunate to work on and be a part of is the focus in Congress on maternal mortality, and particularly as it relates to African American women, and the fact that despite education or despite economics, we are still disproportionately impacted. And so I am part of a group that is actually bipartisan on our Energy and Commerce Committee. I'm on the Health Subcommittee, and so that's one of the areas that we're focusing on. I'm also focusing on environmental justice. I just got information and data that talked about the link between environmental justice communities and maternal mortality, environmental justice communities and COVID-19, and the fact that if you live someplace where there's pollution there, it impacts you. And as we know in Delaware, for Black women, even breast cancer, and I'm sure Bethany can talk some about this and the impact that it's had on us. So I work with Yvette Clark and Robin Kelly, and also Brenda Lawrence, who chair a Black Women and Girls commission for us in Congress. And actually, Robin Kelly has been a big player in the Health Brain Trust. So there are many issues that we're just putting the money there. We're appropriating, and we're also legislating, but we're also trying to take a look under the hood of the agencies themselves. And so we just, in Congress, in our committee, the chairman asked us to create an equity focus for all of the different agencies to hold them accountable. Because I always say there's 4 things you need to look at. One is awareness. All right, when we're aware that something exists, that's fine. But then acknowledge that it exists. Then act on it, and last, accountability. We have to hold ourselves and these agencies and each other accountable. So thank you so much for the question. I totally get the sense of urgency.
Great. And I will add to this, and I know our Congresswoman, I wanted to make sure you got in. I know your time is running shorter than probably the Secretary of mine today, but we're glad you're here. And to our Congresswoman's point and to our Secretary's point, you know, the institutional racism, the discriminatory patterns, both for persons of color and women and our transgender community and others, that's been there, but we are going to chip away, and there is a sense of urgency. And beyond task forces, I can tell you that I'll start with the health side, since our Congresswoman ended there talking about prenatal health and long-term health care in our communities, having that access. I'm hoping your listening audience is working with, at the federal level, even our federally qualified health centers and access. We've worked really hard these past several months to ensure to bring services to the community in action. One of the areas that I've been working for the past 3 years is really around mental health and behavioral health. We saw an issue of equity. We got boots on the ground and went out into the community, not only with COVID screening, but in a matter of 2 months, visited over 4,000 persons, handing them information, getting them services, getting them linked. And predominantly in our communities of color is where we found that. I've been blessed to have the opportunity, just like our Congresswoman, our Secretary, to have conversations regularly. Our Latino leaders, I have a call every other week. I'm meeting with our faith-based leaders every other week, working with others in our community, our Black Law Legislative Caucus here in the state, to really make sure that we have equity. As our Congresswoman stated, and as Saran and Lisa know, equality is not equity. And so making sure we have those resources to get that equity in place. And so we've got a lot to do, whether it's mental health, behavioral health, physical health around cancer. I know many of us for 20 years have put our pedal to the metal and have worked so hard to try to eliminate cancer disproportionate rates of mortality in our minority community. And that came from working with the community. And so I challenge the listeners here, that person who submitted that comment, if you haven't signed up, get signed up in my office with my Behavioral Health Consortium, work with our Congresswoman, work with our secretary. We have a lot of work, but we can't do it alone. Government's not going to be able to do it. We've got to work in partnership with our leaders in the state. So thank you for that question. I'll quit talking because I don't know if our Congresswoman has to leave soon. So I know you might have another question for her before she has to leave.
I actually do.
Oh.
But I do want to say something before I jump off, if you don't mind, Melanie.
Sure, absolutely.
First of all, I want to thank you so much for this forum and for this opportunity and for the work that you do to uplift and uphold women in our state. It is so vital right now, particularly with what we're all going through. And I guess for anybody that is watching this, I want to say to you, while we're talking about programs and all of these things, I want to kind of jump on to what our Lieutenant Governor talked about in terms of mental health and taking care of yourself during this moment. It is an incredibly unnatural situation that we're in, and it requires us to be able to have not just the health of not contracting this virus, but even our mental well-being, our spiritual, all of that, to be able to sustain ourselves and to make it through this. And so I just want to thank you to all of you who have been working on the front lines, those of you who have been supporting your families and friends, and just to encourage you that we will make it through this and that you have to take care of yourself. There's no shame in your game to get mental health counseling or help. I am a witness. I'm a witness. It's important right now. So whatever it takes for you to stay well right now, counseling, nature, prayer, exercise, whatever, take care of yourself and know that we all have your back. We all care about you, and we're all in this together. I love you.
Wow. Thank you, Congresswoman. We thank you. The one
it.
thing, Congresswoman, to your credit, you've been so helpful to the women in the state. Do you want to help me give a 30-second plug, not only to the mental health, but getting resources? And one important step is what? Something that begins with a C called what? The census, right? And go ahead. You take it. Go.
This is my thing, people. We have to be counted. We have to be counted. Please do the census. People are trying to take that away from you. And that is access to resources for our state. That is representation of who is in Congress. All of those pieces are tied to the census. Please, whatever you do, if you do nothing else, be counted this year. Be counted through the census and be counted through the vote. And we're also working on the post office. Okay, thanks.
Thank you.
Take care. Thank you all. Bye-bye.
Bye. All right. And we're staying on. Okay.
Well, thank you to our speakers, Congresswoman Lisa Blunt Rochester, who I know who had to leave, Lieutenant Governor Bethany Hall-Long, and Secretary of Labor Saron Cade. And thank you to all the co-sponsoring groups and people who tuned in with us today. This is our first ever Facebook Live Town Hall, and we hope to do more in the future. Take care, and don't forget to mask up, stay safe, and thank you.
Thank you. Take care.